Okay, let's talk about things you can do right now to decrease your inflammatory response. The hugest impact that you can have on your systemic inflammatory response right now is diet related. So, that's going to be a really, really key portion for a lot of patients that have cardiovascular disease and peripheral artery disease is we really want to have an anti-inflammatory diet. The main components of this diet that you want to avoid are gluten, any grains, dairy, processed foods, refined sugars. You should have a diet that is high in non starchy vegetables. You should have really clean protein sources. You should have limited sugars, and sugars also come from our starchy vegetables and from our fruits, so we want to make sure we're avoiding those. If you can stick to this diet, that will definitely make a huge impact on your inflammatory cascade that is currently going on in your body. This will help make sure that you do have a minimal inflammatory response if you do come in contact with the virus, that it won't already be a huge fire that you're adding gasoline to. Okay? The other thing that we can talk about are different supplements. So, supplements that will help with the insulin resistance component are going to be things like alpha lipoic acid, essential fatty acids, chromium, carnitine. Those are going to be really, really great to really help make sure that we are getting insulin sensitivity, meaning that glucose is getting in the cells like it's supposed to. It's not circulating out in the bloodstream. It's not causing any nicking of those arteries. So that's going to be a really good thing to do. So making sure that you have obviously reviewed these with your physician, but these are some components and supplements that will really help with the inflammatory component of insulin resistance that you might be currently dealing with. The other thing is to add in some antioxidants. Antioxidants are going to be like vitamins A, C, and E. You can use resveratrol or quercetin. Those are also really good antioxidants, and these just help with the free radicals and the oxidative process that happens in our bodies. The other component that you want to look into is if you are dealing with genetic components for cardiovascular disease or PAD, that you want to look into your MTHFR or your homocysteine. Most likely you're going to have elevated homocysteine, so we want to make sure that we're supporting this pathway and having really good B vitamins, so good folate, not folic acid. We want folate, we want good B6, we also want to have good magnesium. Those are going to be really helpful and impactful for this cycle. They can also really help with your overall inflammation. But the most quick and efficient way to really decrease inflammation in the body is to be mindful of what we're putting in our bodies. So if you are at risk for going out into the workplace and potentially catching COVID-19 and you do have these pre-existing conditions, it's going to be very important that you are mindful of what you're putting in your body and making sure that you have a nice anti-inflammatory diet. That would be my advice to anyone with cardiovascular disease, is to really make sure we're focusing on our inflammation, because any virus or bacteria is going to create more inflammation. So we want to make sure that we have decreased our overall inflammation, and that will make sure that if we do happen to catch COVID-19, that our symptoms are not exaggerated and it doesn't become life-threatening.